Good afternoon. Can you hear
Yes.
me?
Yes.
Okay, so I'm Jessie Claudio. I'm from the Institute of Philippine Culture at the Ateneo de Manila University. I'm with my fellow research assistants and research associates, Ma'am Leslie Lopez, Dr. Leslie Lopez,
Hi.
um, Haraya Mendoza,
Hi.
and with us
Ninyo.
in the room are Mr. JP Dalupang, Mr. Miguel Cid, and Miss Mita Santiago from another project in IPC Ateneo. I'm going to introduce Dr. Dennis Batangan for his presentation today. Um, so Dr. Dennis Batangan is a health social science researcher and public health specialist from the IPC Ateneo. So he is also one of the Department of Science and Technology PCHRD e-health projects implementer, and he also oversees health researches at the IPC Ateneo. This includes three ASEAN level projects. So he will be discussing these three projects today. So we have HATID ASEAN, HIIGIT ASEAN, and competency. His academic degrees include the following. So he graduated cum laude from the University of the Philippines, Diliman, under the degree BS Psychology. He took his Doctor of Medicine degree from the University of the Philippines, Manila. And he also has a Master of Science in Community Health for Developing Countries from the University of Heidelberg in Germany. He co-founded the Bukluran for Psikolohiyang Pilipino in UP Diliman, the Community Medicine Development Foundation, and the People Managed Health Services and Multipurpose Cooperative. So Dr. Batangan also received the 1986 Hugh Greenwood Award in Community Service, the 1991 Dr. Tranquilino Paez Memorial Award for Community Health Service, 1995 Dangal ng Bayan Award, 1997 UP Alumni Association Professional Award in Public and Community Health, and the 2012 Medical Action Group Blue Jeans Award. So without further ado, I'll give you Dr. Dennis Batangan.
Thank you very much, Jessie, for the generous introduction. So thank you also for hosting or co-hosting this e-conference, Dr. Hong. What I'll be presenting this afternoon is sort of an overview of the different health technology-related research projects that we're doing at the Institute, and hopefully be able to discuss a possible collaborative project with Chungbuk National University and MedRIC. So the title of the presentation is Health Technologies as a Research Focus in the HATID ASEAN and HIIGIT ASEAN projects. So the presentation would look into the ASEAN research projects of the Institute. Jesse mentioned the three research projects. We'll briefly look into the ASEAN policy and program mandates as a context, and the ASEAN as an evolving platform for these research and related initiatives. And I will briefly discuss a proposed research agenda on bridging governance and access to technologies in health. And we actually were given a document from the ASEAN Committee on Science, Technology, and Innovation on some of the possible research topics for an ASEAN and dialogue partner proposal, of which some are topics coming from the Korean age. I think I have it in the slide. So, and then the proposed next slide, Asia-Korea Cooperation Fund. No, so next. So we have three ASEAN. No, as you know, the ASEAN is the Association of Southeast Asian Nations. It's a 10-member country, of which the Philippines and 9 other Southeast Asian countries are part of. There is a secretariat based in Jakarta called the ASEAN Secretariat, which is monitoring the different projects among the different ASEAN countries according to the pillars of ASEAN. So we have 3 projects: the HATID ASEAN project, which is on e-health technologies and governance and program management among 3 countries, no, Thailand, Indonesia, and the Philippines. We also have the HIIGIT ASEAN project, which is also on health technologies, but more on the health information infrastructure and governance on incipient technologies, also between the Philippines, Thailand, and Indonesia. And we have a third one, which is an European Union project, Erasmus Plus, which is on MOOC or Massive Open Online Courses. The first project on HATID ASEAN actually started in 2015, with a collaborative activity with Chulalongkorn University and Thailand, and later with the National Institute for Health Research and Development in Jakarta, Indonesia. It also started with some form of online discussions, such as what we're having now. And then we had the opportunity to co-host a course in Chula in 2015. We're actually having the third of this series, another course in Chulalongkorn this October, and also a conference to be hosted by Chula in October 2. Sige. The results of that particular series of activities with Chula in Thailand and the National Institute for Health Research and Development in Jakarta is a publication called Breaking Ground for HATID ASEAN. And as we were developing that project, there was another sub-project which was a special project of the Institute on data governance in e-health programs, which coincided with this particular project. The third project on MOOCs or Massive Open Online Course actually had a very recent launching. So you see the picture here of the event that we had at the University of the Philippines, wherein we launched the Massive Open Online Course on data governance. So the MOOC is already being hosted at the Department of Health e-learning platform, and we have around 400 participants on the MOOCs, coming primarily from the specific province in the Philippines, but also there are participants from other parts of the country. Next. As a result of these three related ASEAN projects, the university is preparing now, it's in its final approval process, of offering an elective course in ASEAN health policies, which will explore variations in national health policies arising from country-specific, socio-political, cultural, and historical contexts. So the inputs from this particular course will come from the ASEAN partners from Indonesia, Philippines, and Thailand. And this is also one possibility that we could explore with Chungbuk and MedRIC to be able to offer courses between our two universities. As we were actually implementing these three projects, we are now in the phase of developing a successor project, which we tentatively call HIIGIT ASEAN 2.0. So this will be the second phase of the HIIGIT ASEAN project, which is just starting actually this quarter. But we would like to look already at a next phase project, and in my recent meetings with the ASEAN Secretariat in Jakarta, we were encouraged actually to develop a proposal with the dialogue partners, including the ASEAN Plus 3, which includes Korea, Japan, and China. That's the other reason that we wanted to present this, is to be able to explore the possibility of developing an ASEAN Plus 1, which will mean ASEAN plus Korea, a collaborative project under probably the ASEAN Secretariat. So moving to the next part, which is actually the mandates, policies and mandates under the ASEAN. So we looked actually into what mandates we have as far as the ASEAN is concerned in developing this project. So one is actually the ASEAN Charter provisions. So you'll see here Article 1, Article 2, and Article 2, which looks at development of human resources through closer cooperation in education and lifelong learning, which is mentioned in Article 1 of the ASEAN Charter. And Article 2 on the ASEAN Charter mentions about enhanced consultation on matters seriously affecting the common interest of ASEAN. Next. The ASEAN Economic Community has a blueprint. No, this is sort of the basic document that is being looked at by the ASEAN pillars. No, so the ASEAN Economic Community blueprint for 2025 strategic measures include what we have highlighted here: the promote sectors with high growth potential, such as health, tourism, and healthcare services, which will not have negative impact on the healthcare system of each ASEAN member state. So this is still very generally stated, no, and looks at the healthcare services and healthcare systems within the ASEAN countries, but can also be looked at within the ASEAN +2 or +3 or +1 dialogue partners in terms of strategic directions. We also looked at the MPAC, or the Master Plan on ASEAN Connectivity, and we actually highlighted here Initiative 7 of impact on digital data governance. So what it says here, actually, the focus is actually on personal data protection. That's why my question earlier was on the EMR, no, because that actually sort of encapsulates the health-related digitized management of data. So in the case of ASEAN, the main framework for data or digital data governance rests on personal data protection. So that's something that we have to deal with when we work with e-health or EMRs. The next major issue on this Initiative 7 is data privacy and cross-border sharing. So this is a big issue actually within the ASEAN member countries because, well, everything that's happening now with data privacy and of course the sensitivity of personal data when you share it across borders or even across agencies within a particular country. We highlighted here that the MPAC or Master Plan on ASEAN Connectivity encourages a forum or forums that could then be to share these lessons. So actually this activity and the other online activities that we're doing and the ASEAN projects contributes to this particular initiative. Next. Oh, this is a bit not clear, no, but this is just the health development agenda of ASEAN post 2015. So 2015 was the baseline or the reference year for the medium term or Millennium Development Goals. So after 2015, we're now into the SDG era or Sustainable Development Goals. But this particular health development agenda of the ASEAN will be revised actually, I think, in 2 or 3 years' time. Moving on now to the committee in the ASEAN that we are closely working with, no, which is the Committee on Science, Technology, and Innovation. The main work plan for this particular committee is called the APASTI, or the ASEAN Plan of Action on Science, Technology, and Innovation. So last month, I had a meeting with COSTI in Jakarta, the Secretariat, and they sort of gave me a list of possible topics for coordination, which is already a priority as far as the COSTI is concerned. It's already included in the APASTI for 2016 to 2025. Just a brief overview on the connectivity framework of the ASEAN. ASEAN looks at it along the 3 pillars, no? The ASEAN Political Security Community pillar, the ASEAN Economic Community pillar, and the ASEAN Socio-Cultural Community pillar. The COSTI, the Committee on Science and Technology, is under the ASEAN Economic Community pillar. When you look at connectivity as far as the ASEAN is concerned, they look at 3 areas: physical connectivity, which is the infrastructure; the people-to-people connectivity, which is the exchange through culture, tourism, education, and know-how. This thing that we're doing is also a people-to-people connectivity; and institutional connectivity, which aims to improve regulatory environment to enhance connectivity between ASEAN member states. No? So these are the institutional arrangements between ASEAN member states. We're also going through that because these projects that we're implementing will have or needs institutional agreements between the institutions in the particular member states. In the Philippine side, no, we have the ASEAN NDI, which is the anchor for the ASEAN projects that we are doing. The ASEAN NDI has a legal personality in the ASEAN as a network. So the projects that we are actually implementing at the ASEAN level from the Philippine side is actually hosted at the ASEAN NDI. I would like just to note that working with ASEAN is actually like working with national government, although you're not working now with 3 national governments and an oversight entity called the ASEAN Secretariat. This is how it looks like in terms of an organizational structure within one committee within the ASEAN. So this is the Committee on Science, Technology, and Innovation. And there are a lot of subcommittees. Subcommittee on biotechnology, of which we are implementing these particular projects, and so many other subcommittees. So the subcommittee on biotechnology will have 10-point persons in the ASEAN member states. So each country in the ASEAN region or ASEAN member states has a focal person that is a member of the subcommittee on biotechnology, which is under the Committee on Science and Technology. Any initiative that we want to move into the ASEAN level beyond the committee should actually go through the subcommittee level first. For us in the Philippines, for our initiative to be endorsed to the subcommittee, the focal person in the Philippines for the subcommittee on biotechnology has to endorse the project or the initiative to the 10 focal persons in the subcommittee on biotechnology. Only if the 10 members of the subcommittee on biotechnology approves the project, it goes to the committee level. And then from the committee level, it is processed upward into the ASEAN Secretariat for further approval. So I'm just pointing this out because if we submit a proposal to the ASEAN, we will have to go through this process. Yeah, again. Now moving to the next part of the presentation, which is on the bridging governance, access, and technology in health framework. No, this is one of the frameworks that we've been using for research and advocacy for the specific health projects that we're working in. So we look at the relations between consumer or the people and social institutions, and we see the role of research, the role of technology as a way to shift the burden from the people, from the consumers, and more to the social institutions. So it should be the social institutions who should be absorbing and providing for these access issues, and of course cutting down the costs, no, because the costs become a major issue when you introduce new technologies, when you introduce new systems into the area. This actually came from a advocacy group called the Cut the Cost, Cut the Pay Network, which was a advocacy group on cheaper medicines in the Philippines in 2005. Another framework that we're using with regards to the e-health project that we are implementing is the HATID LGU Research and Data Analytics framework, which I think I presented already in Chungbuk when I visited Chungbuk in 2016, I think. So we're working actually on the EMR part. No? So we have a electronic medical record developed within the university, and it's now being used by the partners, which are the rural health units and city health offices, and reporting already to the Philippine Health Insurance Corporation and the Department of Health. But we realize that there are a lot of other technologies and other stakeholders in in the areas that we work with. So what we work with or we developed this past year is what we call an LGU managed interoperable platform, which is actually a intermediating space for the different technologies to be able to talk and connect and to develop or to generate the necessary reports needed by the partner agencies or other stakeholders. So this is actually a research implementation framework, but also serves as our data analytics framework, because the data that is being captured is also stored in a cloud server under the HATID LGU, and this is where we deploy the data analytic tools that we have developed for data analytics and dashboard also for the users. In fact, before this meeting, I just came from the National Government Data Center of the Department of Information, Communication and Technology, where we installed a new server for our data analytic project, which will also be part of this whole analytics and e-health work that we're doing. So the general design, this was also one of the things that we discussed in Chungbuk in one lecture that I gave in 2016, is such that the facilities that participate in the system using the government cloud facility owns the data that are stored in the government cloud facility. So in a sense, the data owner are the health facilities, which are in this case are the rural health units owned by the local government units. And we provided a dashboard for each of these users for them to be able to see the status of the use of the EMR, and also some aggregate data that they can use for service delivery management and planning and decision making. Moving again now to the last topic, which are the proposed or possible topics that we could possibly work on for an ASEAN +1 proposal. These are actually pre-selected topics which was endorsed to us by the ASEAN Committee Science, Technology, and Innovation. The first one is Social Innovation Research Program for Emerging and Re-emerging Disease in the ASEAN. There would be, of course, specific diseases that could come into this, no? For the one that is commonly being discussed now is the dengue, of course, and but there is some discussion also on non-communicable diseases, particularly diabetes. Next topic is capacity building in data analytics. This is also something that we could work on, because we've seen that there are a lot of methodologies being developed across universities. In our case, we are developing a spatiotemporal analytic tool with predictive analytics, which we could also share, probably in the next session. Looking at dengue issues in one province, and we're starting to look at measles now also in that particular province. The next topic is in development of monitoring tool of SDG indicators. This is also a priority of the Committee on Science, Technology, and Innovation. As we move now into the SDG era, we've done some work on SDG 3.B.3, which is on access to medicines. And we're also involved in some of this monitoring under the Universal Healthcare Initiative or the Universal Healthcare Program of the Department of Health in the Philippines. The last topic is on focused discussion, disaster risk reduction, specifically disaster forecast models, landslide modeling and simulation, and space science, including robotics for post-disaster and rescue operations. So space science is something very new to us. Robotics is just beginning here. But there are already some initiatives and some programs that can be worked on with regards to this particular topic. This next set of slides actually came from the Committee on Science and Technology and Innovation, which focuses on the Asean-Korean Cooperative Fund. Well, we were advised by the ASEAN COSTI that we develop a program with a dialogue partner, in this case Korea. We should understand the Asean-Korea Cooperation Fund framework, which which looks like this. No, so there are three priority sectors: education, environment, and culture. And the direction is create conducive environment for this particular framework. It's actually very general. The ASEAN COSTI told us that the main priorities are education and environment. If your proposal does not fit into this, it goes into the culture component. The new Southern policy, again, came from ASEAN-Korean Cooperation Fund, is focusing on people and peace, people, prosperity, and peace. So people, meaning culture, exchange of people, education, and peace, meaning non-traditional security issues like cybersecurity, disaster risk reduction, environmental protection, and anti-extremism. These are the programs in the pipelines, no, again, from the ASEAN Committee on Science and Technology, Film Leaders Incubator, ASEAN-Korea Environment Cooperation Program, Capacity Development for ASEAN through Technology and Innovation, TVET or Technology and Vocational Education Training, operationalizing the ASEAN standards and certificate for experts in disaster management. The advice of ASEAN COSTI was, if we're going to develop any proposal, ideally it should fit, or it should collaborate, or it should converge with one of these priority sectors, and hopefully or ideally with one of these pipeline programs. So the last slide is actually a proposed next steps, no, for research collaboration. Well, what we could plan the next e-conference, and for our part, we'll probably share the spatiotemporal analytic tools on with predictive analytics for dengue as an input. We could also have a separate discussion for on a concept note for a joint research project, and then proceed to probably an online discussion later on how to proceed with this particular proposed joint research project, and the possibility of his meeting face-to-face in one of these upcoming international conferences, which I think I've sent you at least the first one. The second International Health Promotion Conference of the ASEAN University Network, which will be held in the Philippines, August 19 to 21, Novotel Hotel. On the 21st of August, we will actually have a launching event for the course that I mentioned earlier, and the publications that we have, no, from the University Ateneo de Manila University. We will have a another event in Thailand. No, this is going to be a learning interaction event, but the main conference will be on October 2. This is an international conference hosted by the Chulalongkorn University, College of Public Health Sciences, in collaboration with Kyoto University and Harvard University. So we will send you the details also for that October 2 conference, and perhaps you could join us, and probably we could have a meeting in Bangkok. The last conference is actually to be hosted by the National Institute for Health Research and Development in Bali, Indonesia, sometime in November. We still don't have the dates, but once we have it, we'll share it with you. We will also be having a panel in this conference for the ASEAN projects that we are developing and or currently implementing. So if you manage to attend this conference, we could also probably meet here for the initiative that we're working on with Chungbuk and MedRIC. So I think that's all, and I would appreciate your comments, suggestions, or questions for my presentation. Thank you.
So are there any questions from the Korean team?
Okay, first of all, thank you so much for your great presentation. And thank you again for your proposing to join your research collaboration activities. I will discuss your suggestions with our MedRIC teams and the director. And you cover the many huge area, including data management analysis and the government cloud facility connections and research agenda and project you are conducting now. And I was wondering, so many projects going on these days with ASEAN, and what is the target or ultimate goals or purposes of the ASEAN projects?
Well, the ASEAN projects is actually in the phase.
You presented the three projects, and you introduced the Asian member states and countries. So all together, so what is the ultimate goal or purpose of the Asian community?
Thank you very much, Professor Hong, for the question. The three projects that we're working on are actually coming from different entities within the ASEAN, but the general direction of the ASEAN is actually to understand the different policies and contexts of the different countries across different issues and concerns. Now, for example, in the health sector, we need to understand the current policies and programs in the Philippines, Indonesia, and Thailand before we are able to discuss specific e-health technology. So we're still in that phase, of looking at the governance framework, the national local policies, to be able to move into a specific area of collaboration. So what we're doing now is actually developing specific methodologies that can look or understand better the different contexts in these particular countries. So the results of these particular studies using these specific methodologies used commonly by these different countries can now lead us to a governance framework or a governance initiative that can move on to another project or another initiative for the ASEAN countries. In the ASEAN context, we need to be working with at least 3 ASEAN member states to be able to have an ASEAN project. I would like to ask Dr. Leslie Lopez to further explain that part now, because she's working on the governance part of the ASEAN projects here in IPC.
Good afternoon. I'm working on the HATID ASEAN project, and the objective of the project is actually to marry the national and the regional policies, because we would like to have information on how we can frame the e-health governance within the context of the ASEAN. So what we're doing right now in the Philippine side, at least, is to look at the experiences of both public and private hospitals in a pre-selected urban and rural province level to see what their experiences are. And these experiences would feed into the results of the study, which will be shared with our partners in Thailand and Indonesia. And then jointly, we will also share our methodology. So we're documenting our methodology in the hope that the same methodology would be used by our partners such that there's comparability in the results, and after which, during the conferences that are scheduled in the coming months, we would be able to compare our experiences on e-health, given the context, specific context of each country, and be able to frame a more regional level framework that we can present to other potential partners from the ASEAN beyond Thailand, Indonesia, and the Philippines. Thank you.
Thank you so much. And are there any questions from our Korean side?
Can I ask a question? Thank you, Dr. Batanga, for your very various project. So one of my question is that to prevent that dengue fever from outbreak, is there, so where does the medical record regulation stand in Asian countries overall, or particularly in Philippines? Because you mentioned dengue fever many times.
Yeah, there's actually a reporting system because dengue is a reportable, this is notifiable disease, no, in the Philippines. So there is a regular or routine reporting system for dengue on a weekly basis. So that data is actually being collated at the province level. And then the province then reports it to the central office of the Department of Health, which is collated I think also on a weekly basis. So what we did actually is actually develop a new tool, a new analytic tool at the province level that will analyze the data that is already collected at the province level, so that it can do predictive analytics on the potential number and potential location of dengue cases in the next 6 months. So what happens is that the provincial health authorities will have a clue now. They will have an indication of the potential number of cases of dengue and where it will happen, because this is a spatio-temporal analytic tool, meaning the dashboard will tell you the number and the location in the map of where the potential cases will happen.
Then do you share that dengue fever report, the kind of outbreak report, to other Asian members?
We cannot share the output because of data sharing policy. What we plan to do, there's been a request actually from Chulalongkorn University and of course our partner in Indonesia to show the methodology and the application, because this is an app. No, we develop an app for the dengue analytics. We could actually show it, but we will have to clear it up with our TMO, Technology Management Office, for IPR issues. But the methodologies can be shared. No, the data we cannot share.
I see.
So
Okay.
the plan with the partners with Chulalongkorn is, if we bring the app in Chula, once it's cleared from the IPR side, is they will test the app with their own data. Chulalongkorn will have to have access to dengue data in Thailand, and then use the app and test the app for possible use or application in Thailand. So that kind of sharing will also be done through an ASEAN mechanism. So the partnership that we have now with Chula will allow us actually to share certain technologies, certain methodologies that we're developing, and for them to be able to see whether that's something that they can use. That's something that we also would like to explore with Chungbuk and MedRIC, because there are a lot of technologies being developed from your side and also from our side, and some of these technologies might be useful to your side, and probably some are useful to our side as well. But there are a lot of legal, administrative issues that we have to sort out before we could start sharing these technologies across different countries. That's part of the reason that we're being involved in these ASEAN projects, because the ASEAN allows us to do it, and actually guides us and asks us to do policy analysis and asks us to make recommendations on how we could actually share this information, these methodologies across borders.
Okay, thank you so much. Okay, before wrapping up, is there any comments? Okay. Actually, I was very interesting to know the project you introduced, maybe the later part, Asian-Korean Environment Cooperation Program you introduced 2018 to 2019. Is it still ongoing?
Yes, those set of slides came from the ASEAN Committee on Science, Technology, and Innovation, and I think it came from the Korean Foreign Affairs or Bilateral Cooperation Department. So,
I
what
saw
the
a picture
ASEAN,
of Mr.
yeah,
Kang.
So it came from the your government side, but
Okay.
because I had the meeting with the ASEAN-COSTI, they encouraged us actually to collaborate with a Korean partner under
Okay.
that particular cooperation fund.
Okay, thank you so much. Okay, it was a good conference, I think. Pretty clear screen, and we hear your voice very clearly. And so, thank you again for your participation. And I hope we join again later e-conference together.
All right. Thank you, Professor Hong. We'd also like to thank the Korean team for accommodating our request for the e-conference. We'd love it if you could share your PowerPoint presentation with us. We'll also be sending our PowerPoint presentation.
Sure.
Sure,
You?
no problem.
Yeah. Okay, sige po. We can we can email you to facilitate the PowerPoint sharing.
Let
Okay.
us share it through email system.
Yes.
Okay.
All right. Thank you very
Bye.
much.
Have a good evening.
Bye.
Bye.
Medical Research Information Center, MedRIC.